we welcome you to the City of Gadsden COVID update for the City of Gadsden and Etowah County. My name is Deborah Gaither. I'm the emergency manager for the city and for the county, and we just appreciate all of our elected officials and our hospitals and our public health participating today to educate our citizens and to all work together to stay safe and stay healthy. First, we'll hear from Mayor Sherman Guyton. Then we'll hear from Councilwoman Cynthia Tolles. And then third, we will hear from Mary Gomillion, who's the District Administrator for Alabama Department of Public Health Northeast Region. I'd like to ask you all, as you finish, please exit to the seats, and then the next three speakers will come up. All right. Thank you. Mayor?
Thank you very much. I'll be quick about this. We want to cut through the rumors and the talk and get to specific information today about the coronavirus. And I think you're going to hear a lot of things you really need to pay attention to. I've received multiple personal letters, notes, calls, including from practicing physicians asking for help to get to wear a mask and take this disease seriously. It's a deadly virus. You can have it, you can carry it, you can give it to a loved one or a neighbor and not even know it. We need everyone to wear a mask when out in public, social distance, wash your hands, and avoid unnecessary gatherings. I ask you to listen to the medical professionals today and to follow their guidance so that we can get a handle on this situation. You may think you're healthy, and you may be, but you also may have an issue that you don't know about in your body. And all it takes is one time, and it could be too late then. So why take a chance? Keep a mask. I keep a mask in my car. When I get out of the car, I put it on my face. And then when I get back in the car, I take it off. Most of the time, I leave it anyway. But we got to get past this because it is ruining a lot of things and killing a lot of people. And a longtime physician here in town wrote me a letter and told me to really urge everyone to take care and notice what's going on, because he had a personal friend who also was a physician, and they were partners for a long time, and that guy died here a few weeks ago. And I can't tell you how serious this is. And I know some people say, oh, well, you know, I probably used to be that way myself. But when you get to see all the people dying, you're going to think, and I'm sure after the 4th of July numbers come in, it's going to shoot up again. So listen to these people and pay attention to it and try to follow the guidelines. Thank you.
Good morning. It's very important for the citizens to know wearing a face covering is very important. I can say personally that the 3 members of a family that died, and they had the funerals back to back to back. So that was very close to me. So it's important that we try to do something that would alleviate this. Cloth face covering is recommended just as a simple barrier to prevent respiratory droplets from traveling into the air and onto other people when the person is wearing the face covering cough, sneeze, or talk or raise their voice. And this is called source control. This is recommended based on what is known. And so face cloth covering is a critical preventive measure, and it's most essential, especially in this time of social distancing. So this is important for our citizens. And yes, I'm probably like a lot of other people who really don't care for putting the mask on and having to wear the mask all the time. But when I go out, because of my age, because of the fact I have no problem saying that I have underlying conditions. And so because of that, I want to protect others as well. I want to protect my family, and I protect myself. So it is very important that we consider covering with a mask.
I'm Mary Gomillion, and I'm with the Health Department, and I want to just talk to you about what's gone on in Etowah County over the last 14 days. 40% of our total cases have occurred over the last 14 days, but testing has only been at a level of 26% over the last 14 days, so there's a big jump in cases. Our positive rate has gone up to 13.1% in this community, which is a big jump. And I wanted to go back and address another area, and I'm so glad you brought up the underlying health conditions. We're a population in Etowah County where a number of people have underlying health conditions. And you may not have one, but your family may have one. And when we look at the deaths, underlying health conditions play a big part in who dies and who is sick for an extended period of time. And we've seen a lovely nurse in our community come out and talk about how long she was sick, how, the struggles that she continues to have. It doesn't just end when you test positive. She may have struggles for the next 6 months or a year. And I just can't stress enough how important it is to follow social distancing, to wear the mask, to do all the things we need to do to keep everybody safe. And finally, I just want to take an opportunity, and my staff asked me to do this. We have received tremendous support in our community. I want to thank every partner that we have in this community. If we've needed something or we've needed to have people help us set up test sites, it's happened, and it's just an honor to be part of a community where people are that caring and that committed to our citizens. And, we want to do our part, and we want to continue to do this as long as it takes, and we may be in this for a long time. So I can't stress enough what a wonderful community this is, and we all need to do our part to protect our citizens. Thank you.
Good morning. Thank you to the media for being here. Thank you to EMA for putting this together, and our president for thinking about doing this, and to the mayor's office. Listen, this is a very tough time right now. We are in a pandemic. It's not about me wearing a mask. It's about you. When I wear a mask, if I have the coronavirus, hopefully I will not give it to you. So if our chances would go down, so if both of us wearing our masks and we're close together, our chances will go down even more. So we need to wear a mask. We've talked about this and talked about this. Our numbers are going up. Our young people don't believe in this for some reason. I went out to the fair when we had the fair here, and there was no social distancing, and I would say maybe 10% of the people there had the mask on. So we have to do better. We have to continue to stress the wearing the mask. When I was a police officer for 26 years here in the city, and it's about public safety. It's about trying to protect this city and this county, and that's what it's all about. So we're going to do all we can do to get the word out, because our numbers are not going down. The coronavirus is still here. And we're opening up the city, and we're opening up the state and the nation. It's about economics. It's not about our health. So we need to wear this mask. And I know a lot of people, now it's left and right. Everything is conservative or liberal. That doesn't have anything to do with it. We have to come together, and hopefully we'll make it mandatory to where we would wear a mask. We'll do an ordinance hopefully here in the city. I know I didn't supposed to talk about that, but we need it. It's well due time. We should have had it a long time ago, but sometimes we're slow about doing things because we want to get it right. Think about it like this. Even if you don't want to wear a mask, if you know someone that's in the healthcare field, if you know a doctor, a nurse, or anyone working in a hospital, why do they have to take more of a chance of catching the disease by working on you if you were to put a mask on? That's all I'm asking. It's very simple. We've asked our young people, we've asked generations before to sacrifice, so we ask them you to sacrifice and put a mask on. That's not taking your rights away. Thank you.
Good morning. Thank you all for being here. Appreciate the opportunity to share. I'm Kent Back, City Councilman, District 4. You know, in the midst of this coronavirus pandemic, it can be easy just to hunker down and focus on keeping yourself and your own loved ones safe. But as we all settle into what will be an unusual time, it may be time to revisit some age-old adages like love thy neighbor, do unto others. Sharing is caring, and a friend in need is a friend indeed. You know, now more than ever, your neighbor may be in need and might need your help. And you can be a good neighbor while still practicing social distancing. For instance, you can call or text your neighbor and just check on them, especially if you haven't seen them in a few days. You can leave a note in their mailbox. You can slide it under the door. You know, regardless of how you get in touch, you know, here's 3 reasons to check in with your neighbor to see if there's anything you can do to help during this coronavirus pandemic. You know, number 1, being a good neighbor is in style. Helping is part of building a great community. Helping to stop the spread of COVID-19 is just paramount right now. And in addition to that, we have a new social media campaign that you're going to be seeing probably starting this afternoon. And we need your help to help us share this information. We encourage you to share a photo of yourself wearing your face covering and using the hashtag #MaskUpEtowah. We also need your help in sharing this campaign with our Spanish-speaking citizens and our hearing-impaired citizens. We want to make sure as we communicate effectively with all so they can be as prepared and as safe as possible. You will find the videos for all citizens on the GEC EMA Facebook page and Twitter account. It'll also be listed on the City of Gadsden website as well. And, you know, just to add a final note, there's, as Councilman Worthy mentioned, this is a semi-divisive issue at a time where, in my 61 years, I've never seen our country at such a tense moment. I've been saying this for weeks now. We all need to step back, take a deep breath, and think of others, okay? Think of how you would want to be treated if it were in reverse. So it's real easy to wear a mask. I don't buy the argument that it is taking away your rights. This is a temporary program. This is not going to be for the rest of our lives. It's just smart to do, and it's thoughtful to do, and it's not as inconvenient as I think we make it out to be. We all wear seatbelts. We all do certain things that society requires in our cities and don't think a thing about it now. So really consider your stance on this. Reach out and be a kind neighbor and a kind citizen and wear a mask. And thank you all for your kind attention. Thank you.
Hello, I'm Corey Ewing, CEO at Gadsden Regional. I will echo what the rest of the speakers today have said in regards to masking, social distancing. The majority of it is about protecting other people. It's not necessarily about protecting yourself. Let's help stop the spread of the virus. But really what I wanted to focus on today is the things that the hospitals have in place here in the community. Sherry, that you'll hear from later, will probably echo some of the same sentiments that I have, but I will tell you, the hospitals, a lot of people that what we're seeing are patients are avoiding coming to the hospital because they're afraid of the coronavirus. I'm here to tell you guys that we have precautions in place. Hospitals prepare. We practice for disasters. We have done for years. We have practiced for disasters. Coronavirus is just another disaster. So we are prepared. We put precautions in place. We started planning in February when we first started hearing about coronavirus. How do we get ready? What is this going to look like when it hits Etowah County? How are we going to keep our staff safe, the patients safe, our physicians safe? So we've been planning and preparing for this. So we have all the precautions in place. We're screening everybody that walks in the building. It does not matter if you are a visitor, a patient, a physician, everyone is getting screened when you come in the door. We require a mask if you're in the 4 walls of the hospital. You have to have this on if you're walking around in the hospital because we don't want to continue the spread. So I would say please do not delay care. If you have a health need, do not delay coming to the hospital. It is a safe place. It's interesting. We meet with the EMS folks regularly, and what we're hearing and what they're hearing when they go out to homes, even if a patient is calling 911, the patient says, please don't take me to the hospital. Treat me in my home. Well, that's So we've even gone as far as have our ER docs, they're willing to take a phone call from the field to tell them it is safe to come to the hospital. So I would just echo, yes, do social distancing when you're in public, wear your mask, practice good hygiene, but please don't delay care. We are prepared to take care of you. It is safe to come to the hospital, so please do not delay. It's unfortunate we're seeing people that are coming in that are acutely ill because they have delayed it and they're in much worse shape than they would have been. But I will continue to say, wear these. I agree with everybody that's spoken. This is the way we're going to stop the spread. So thank you.
Just a second, guys. See how easy that was? I want to talk to you. I'm Councilman Jason Wilson. I want to talk to y'all about a couple of things. Number one is our outdoor spaces. We're having some issues as we reopen the park systems with people kind of ignoring those social distancing rules. You think, okay, I'm outside, I'm on a trail, it doesn't matter. But still, if you're outside and you're on a trail or you're up at the falls and there's a group of 50 people all standing around shoulder to shoulder, COVID doesn't know you're at the park exercising. They just know you're within contamination reach of another person. So please, as you go out and enjoy the outdoors, just keep in mind that you still need to maintain social distancing. You still need to wear a mask. If you cannot maintain that social distancing, even if you're outside in a pavilion or a public space, just try to avoid those scenarios. Maybe try to go exercise during off hours of the day where not as many people will be out on the trail system. So just common sense things. And then the other thing I want to talk about is if you have symptoms of COVID-19, please go get tested. We have testing facilities throughout Etowah County. Any reports of long delays or waits for testing are simply not true. We have done a lot to put that testing in place, and that's very, very important to provide services to those people that are most affected by COVID-19. And as everybody else up here has said, you wear a mask not necessarily to prevent yourself from getting infected, but to prevent the spread of the virus. And the greatest point about that is, I think I read an article that almost 40% of those people who are testing positive for COVID-19 are asymptomatic. Well, that means they're walking around with no visible symbols of the illness. And that, I think, is what a lot of young people are misinterpreting to mean that this isn't a very serious thing. Well, if I can get it and don't have symptoms, then it's not a big deal. But again, it's not about you. It's actually the scariest statistic about this is that 40% of the people can be walking around contaminating other individuals with this virus and not even know it. And that's why it's important to wear a mask, even if you don't feel bad, even if you don't show symptoms, because it's not about you getting the illness. In fact, there's good statistics that if you're young and healthy, you're likely not going to die from it. But when you go to visit your elderly grandparents or some other individuals that have pre-existing conditions that are vulnerable, that's where you are really part of the problem and not part of the solution. So please go get tested, follow your physician's guidelines, isolate, quarantine for 14 days if you test positive or until you get your test results back. I do know of a couple of places that have had some extended wait times on their testing, but you got to wait it out. If you have been exposed or you have symptoms and you go get tested, you've got to wait. Most of these places that I'm going to list to you guys, the average turnaround time is about 48 hours. But even if it stretches into 3 days or 4 days, you need to quarantine until you get those test results. Otherwise, it's pointless. Going to get tested doesn't make any sense if you're not willing to isolate yourself until you know the results. So here are a few locations in Etowah County where you can get tested. Southern Immediate Care in Atala, 956 Gilbert Ferry Road. Their phone number is 256-568-8818. Care Plus in Rainbow City, that's 115 West Grand Avenue, 256-442-6400. The Super B Pharmacy / McKesson's Health Mart at 3354 Rainbow Drive. Their number is 442-2592. The Etowah County Health Department, of course, at 709 East Broad Street, 547-6311 is their phone number. The American Family Care Clinic in Gadsden at 366 East Megan Boulevard. Their number is 485-0983. And then, of course, Gadsden Regional Medical, Riverview Regional Medical Center. Just call ahead before you're going to be tested to make sure that they do have testing kits available at that location. If not, again, you have several options in the county. So even if you call a place and they may be out of tests momentarily, you can go to several other places. And the last thing I want to say is I'm going to hit on this a little different than some other people maybe have. You know, we hear a lot of times, a lot of talk about being fiscally responsible with taxpayer dollars and making sure that we spend money the right way in this community. And obviously, we've had some financial challenges to overcome over the last year or so in Gadsden, so it's even more critical that we manage our money tightly and we manage it appropriately. I want y'all to know that this county has spent millions and millions of taxpayers' dollars fighting this virus. And for every day that we don't adhere to these social distancing guidelines, that we don't wear these masks, we are piling on to the cost. The federal government has already spent over $3 trillion because of this pandemic, y'all. That's 35% of what they said it would cost to give universal health care to every person in America. They estimated that would cost $10 trillion, and we've spent $3 trillion in 3 months trying to fight this thing. So if you are a fiscally conservative person, if you believe in the taxpayers' money being spent wisely, you should be wearing a mask, because this virus is having a tremendous financial impact on our community. So please, social distance, wear a mask, and let's get past this thing so that we can move forward as a community. Thank y'all.
Hi, I'm Sherry Fryman. I'm the Chief Nursing Officer at Riverview Regional Medical Center. I want to talk about how this affects everybody. So stop and think that if you have a primary care physician and you have not contacted them, then I highly suggest that you do prior to needing them to find out what their new policies are. For example, a lot of our primary care physicians will do a telephone call with you. They'll do video conferencing. They have different hours for well people that just need prescriptions refilled versus sick people. In some instances, they even have 2 separate locations. So I know one of our physicians, she has an office where the sick people come, and then she has one in a different location for well people only, so that we can kind of alleviate your fears and kind of help you through this process. I echo what Corey says. Really, the hospital is one of the safest places to be. I cannot begin to tell you that I feel 100 times safer in my hospital on a daily basis than I do walking into some place like Lowe's or Walmart, okay? Because we are very hyper aware of what is going on and how this spreads and what we need to do to keep ourselves and to keep you and your loved ones safe. The other thing that I'd like to tell you, so with our physicians in-house, they're taking care of more patients than they ever have. Their loads are very heavy right now. And yet, in spite of all of that, they are working really greatly together. They're working to find out what is the latest and greatest the resources out there. The drugs that we're giving changes on a daily basis, and they're having to keep up with how that works and what we're going to be doing. And I'm very proud of them. I'm very proud of the progress that they're making with being able to provide us with the same level of care as you're going to be getting in Birmingham. We just recently got convalescent plasma here in town. Corey will be getting that probably next week at the earliest. And we're going to be working together to make sure, because one thing right now is that it's not Riverview and Gadsden and we're competitors. Right now, we're in this together. So I'm making phone calls and making sure that when a physician says to me, hey, we want to try this, then I'm saying, hey, are you talking to? And that's what we're trying to do to make sure that we are having the exact same resources available and that we can help you guys, because that's what we're here for. And I believe that we're working better today than we ever have. The other thing is nurses. So my nurses are tired. Corey's nurses are tired. They're working overtime. They're coming in and filling in places that they've never had to work before. I had PPE on the other day taking care of a patient for 30 minutes, and I had sweat just in 30 minutes pouring down off of my body, and these people are wearing this 12 hours a day. So what you can do for us is, number one, please be patient. Just have a little mercy and grace right now, because we're really operating under some extreme circumstances. Number two, if you can make sure that if you have a loved one in the hospital, that you have a point person, one person in your family that is going to call and be the person to ask questions and to get updates, that would be super fabulous, because they have to take all of this stuff off, wash their hands, go get the phone, and that's taking time away from the bedside of where we need to be with our patients. So if we had one person that we were able to communicate with, and that person then talked to the rest of the family, that would be fabulous. So if you can just make sure that if you do have someone in the hospital, that you clearly let us know who that person is, that would be great. Also kind of know ahead of time what the visitation policies are, because we are owned by two separate organizations, and we have a little bit different rules and policies. So make sure that you kind of know, and then if you will, please be understanding of those policies. They're in place to protect the staff so that they can continue taking care of the patients. They're there to protect the patients from being exposed to grandma who doesn't know that she's asymptomatic and that she's walking in to see her granddaughter. So some of the things that we have found early on, unfortunately, was that the visitors were spreading it more so than anybody else. They were coming in, seeing somebody that was asymptomatic, and now they go back home, and now that everybody in the family has it, okay? So that would be a great help too, to just kind of understand why we're doing what we're doing. It's not because we don't want you there, because believe me, we do. Our patients have better outcomes when you're there. They're happier, they're less depressed, they feel more motivated to get out. So we do want visitors in the hospitals, but we do have mandates not only from the governor, but also from our organizations that tell us these things. So please just be patient with us. Think happy thoughts for us. If you pray, please pray for us. I mean, this is the time that we need everybody supporting us in any way that you can, because, you know, healthcare workers, we get depressed too. And it's a little sad sometimes. So just having somebody walk by and say, hey, great job today, I appreciate you. Oh my gosh, getting a card from your family member is the biggest thing in the whole world. It will make the whole hospital floor's day. Just a little text, a little something that says, hey, thank you so much for taking care of mom. She really loves her nurses. She really loves her doctors. That goes a long, long way right now, so that as a community, we are all in this together, and we're all working for the same goal, which is to beat this and to come out of this with the least amount of people exposed as possible. So thank you very much.
We'll have two questions from each. If you have a question, go ahead and ask that, and then the appropriate person will answer. Yes.
I have a question for the mayor or any of the council members. I know Councilman Worthy said he wasn't supposed to talk about it, but can y'all speak to whether y'all are considering any type of mask ordinance?
And I do think that's going to be addressed in the closing, and that will be Councilwoman Toles. Okay? Any other questions? Yes.
This is kind of for the hospital folks. I know we've seen a surge in cases, and hospitals are sort of the second part of that as a lag time. How are y'all's capacity? Like, have y'all seen a rise in people coming to the hospitals from COVID?
And could y'all come to the front and answer that so that everyone could hear? Just repeat the question and then.
The question, to answer your question about have we seen an increase in volume in the hospital related to COVID, yes, we have. We were very fortunate. I will still say Etowah County was very fortunate. We were not one of the harder hit communities in the state. But over the last, what do you say, probably 3 weeks? Probably the last 3 weeks, we've seen definitely an increase. I will say we're still fortunate because the overwhelming majority of the positives we've seen in Etowah County are not acutely ill enough to require hospitalization, but we have seen an uptick. We're back to what our high water mark was in April. Like as of today, I have 12 positives in-house at our facility.
I have 17.
So Riverview's got 17. So it's definitely, we've seen an uptick, and hopefully we're not going to continue to see that uptick, but absolutely, I know we've seen it in the last 3 weeks. So
It's been interesting to say the least. We're probably at about 80% capacity right now, and we're taking measures to create overflow areas and be prepared because we want our patients to stay in our area. It becomes even more of a burden on your loved ones if they have to travel outside the area to come see you, to be involved in the care. So if at all possible, we want them here. The good news is, as Corey said, the cases that we're seeing are not quite as severe as they were in the beginning. The faster we can get you medication to treat you, the faster. So as Corey said earlier, please don't delay. Please come into the hospital. Let us evaluate you, see what you need, and if we can, we're going to send you home and have you self-quarantine there. We would like you to stay at home, and we want to help you there, but we also want to be able to sure we get the optimum amount of treatment that we can for you.
Any more questions? Yeah.
How does the health department, how quickly does the health department update positive tests and people who died from COVID-19? So the person I know personally who died over the weekend, the number didn't change for several days.
And that question has been asked, and I think Mary can better answer that than I can. There are some glitches, and they're working on those now, if you want to update on that.
They're in the process of converting over to a more automated system for death counts, and that's ongoing now. So we hope that we'll see those things updated, and we hope the process will be quicker and faster in the future.
And daily, those numbers on the website are updated at 10 a.m., so you can see those updates live. I would be remiss if I didn't mention that these are just a part of the team that is responding to our pandemic. We have law enforcement, we have fire, we have EMS, waterworks, public works, many facility groups. It is a countless amount of names, entities. Our schools are really, really gearing up and preparing. So we're not just doing it and asking you to do it for ourselves. We're asking you to do it for all of them. They go home, they do their job, they go home, and they could be spreading the virus to their loved ones. If we all take precaution, we can all help stop the spread. In close now, I'll ask Councilwoman Tolles.
I would just like to reiterate the thank yous of the council members, the mayor, for allowing this to happen, this press conference to happen. Yes, we haven't been talking, but Councilman Worthy has been badgering about having an ordinance for mandatory mask wearing. And so yesterday I had a conversation with the mayor, who I asked, would he have a conversation with Attorney Roberts to draft us an ordinance for wearing the mask. We're looking at having that in pre-council on Tuesday, and then we will discuss it. It will be up to the council whether it will go into effect or if it will pass. I don't know if there's any questions concerning the ordinance. I'm sure there will be a time then, but we're planning on having an ordinance in place as soon as possible as Tuesday. Any other questions? As far as the detail of the ordinance, that will be something that will be discussed then, And at this time, well, not at this time, but at that time, we will probably have the attorney there, and it'll go into depth as far as that concerned. But it's important, it's essential, and I want to thank the healthcare workers, the essential workers. I want to thank all of those that are working in the hospital. I always said, even as a professional, never wanted to be a nurse, because you have a tough job. And I know we all have tough jobs, but they're putting their life on the lines too, the nurses, the doctors, everyone that's working with this. So we appreciate everything that you all do. We appreciate all the information that you all give us, and we just asking, it's almost begging our citizens here in Etowah County to protect yourself as well as protect your families. Thank you.
And thank you for attending. Please help share the word. Thanks.